Physiowebseries Knee Complex Season 1. Let's begin with Series 4. We will be discussing about the biomechanics. As we can see in this diagram, we will see how the soleus and gluteus maximus muscles assist in knee extension during weight bearing activities. So this is soleus muscle and this is gluteus maximus. We have resolved the force vector of soleus this way, getting the resultant in this direction, and for gluteus maximus the force vectors are again resolved so that we get the resultant in this direction. Now considering the bone one by one. First of all, the tibia. The tibia is placed this way when the knee is in flexed position. Over here the knee is in flexed position. So if we isolate this tibia, we can assume that this is the tibia. The upper part of tibia is slightly ahead when the knee is in flexed position. Now we have to put it back to extended. So we need to pull this upper part back and down this way so that the tibia becomes straight. Now this pulling back and down of the tibia, upper part of tibia, is done by this resultant force acting over here. So the tibia will be pulled back from its upper part. Now as this resultant force of soleus is there is one equal opposite force generated by gluteus maximus on the femur, upper part of the femur, trying to pull it away from the tibia to assist in knee extension. So we came to know that the upper part of the tibia will be pulled back. Now what we need that the femur, which is in this manner over here like this, we need the upper part of the femur to come ahead, to be pulled ahead so that the femur becomes straight and assist in knee extension. So here this resultant force will act in a manner which will pull this upper part ahead. It is up and ahead, we can assume it that way, so that this comes here and the femur becomes straight. So in both of these bones, the femur and the tibia, in femur the gluteus maximus and in the tibia the soleus, has to work in such a way that the soleus pulls the upper part of the tibia posteriorly and the gluteus maximus pulls the upper part of the femur anteriorly. So this force and this force will help to extend the knee. We can imagine an elastic string which is joined at the center, assuming this is the knee joint. Now this string is, we can say, in a flexed position. When the knee is in flexed position, it is bent, the string is bent. We have to straighten it. So what we will do, we will focus on its end parts. This is the end part of the upper string. This is the end part of the lower string. Now considering that this is femur, we are going at the end part, not exactly the end part, but it would be the upper part. So upper part of the femur, we will try to pull the string in this direction so that it straightens. Same way, this is the end part which will be the lower part for the lower string. We concentrate on the upper part of the lower string. So we want to pull it in this direction so that the string becomes straight. Making it clear. So this will be pulled ahead, the upper part of the femur, and this upper part of the tibia will be pulled back. Same way, the soleus is acting in weight bearing activity to pull tibia, upper part of the tibia posteriorly, extending the knee joint, and gluteus maximus, the resultant force, is acting on upper part of the femur to pull it anteriorly. and both of these force acting this way will bring the extension of knee joint. So soleus in weight bearing will assist with knee extension by pulling tibia posteriorly, as we have seen now. Gluteus maximus during weight bearing will also assist in knee extension plus the ankle plantar flexion. So this was about the soleus and gluteus maximus, how they affect the weight bearing activity, or they play their role in weight bearing activity to help in knee extension. Even though they are not crossing the knee joint in a proper manner, then too they assist in knee extension. So this is something important to remember about soleus and gluteus maximus.